Thank you. It's a pleasure to be here. I am a plastic surgeon. About 3 years after I finished training, I was in my office seeing patients. I was on call. I was also 5 months pregnant. My secretary buzzed me to say that there was a family practice resident on the line. She wanted me to see a consult. So I picked up the phone, and the resident described a gentleman with a large groin wound that he'd had for about 3 months. I asked a little bit about the history, and then I said I'd be going to the hospital later that day as soon as I finished patients. She thanked me, and then she said, "There's just one thing. He has AIDS." This was in the early 1990s, when AIDS was a death sentence. I had trained in the surgical culture, working 120-hour weeks through bronchitic coughs and fevers and menstrual cramps. And I was as tough as any of the men. But the men were never pregnant.
Oh.
And so our codes of ethics and our societies and even the law weighed in to say that a physician could never refuse to see a patient with a contagious disease. My brain had been marinated in this, so I never even considered refusing to see the patient. At the end of my day, I went to the hospital and met the patient. His wound was huge. His femoral vessels were exposed. I was going to need to perform a big, bloody muscle flap with lots of needles in order to get it closed. I explained the operation to the patient without showing my own emotion, and then I went to the nurse's station and sat down to write the consult note. As I was writing, another physician came up. He introduced himself. He was the attending. We'd never actually met before. He asked, "Do you think you could get that wound closed next week?" And I thought, and I said, "Yeah, we'll clean up the wound with dressing changes. We'll beef up his nutrition. Let's shoot for next Wednesday." So he thanked me. I went to the parking lot. I got in my car. I turned on the engine, and I turned off the radio. My thoughts were so loud, I just needed silence. That night, I couldn't sleep. I had nightmares of needles and scalpels and bleeding and sticking myself and contracting AIDS and infecting my fetus with AIDS. My little baby daughter, I knew she was a girl. Even if I tested negative, I wouldn't know for 6 months if I were truly negative, which meant I wouldn't be able to breastfeed. I didn't sleep that night, and I knew I wasn't going to sleep any night until that surgery. I was sick at heart. The next morning, I went to work. My secretary buzzed me. That same family practice resident was on the phone. So I picked up, and she said, "The attending was wondering if it would be okay if we asked someone else to consult on the patient." He must have seen my pregnancy bump. I said yes. He did what our codes of ethics didn't do, what our society didn't do, what the law didn't do, what even I didn't do. He looked after my little baby girl. Thank you.